Let's look at the impact of drug or substance abuse and addiction on workforce and productivity. Until it gets to a certain level, it doesn't show on the face that maybe your staff, for instance, has been involved with drugs. How do we handle it?
Thank you very much. The impact of substance abuse in the workplace cannot be undermined. And listening to the guest you have earlier on, how he, explicitly gave us a lot of things about what substance abuse is, and how to manage it. I mean, he has done a whole lot of justice in that regard. But coming to the workplace, you find out that the substance abuse can affect the individual, that's the employee now, which will in turn affect the entire organization, because the individual who is the abuser is an integral part of the entire organization. One of the things substance abuse does is the fact that it impairs even the creative aspect of the abuser. So that means that person has an impaired cognitive part of himself or herself, so to speak. So in terms of trying to think through things, in terms of how to concentrate, in terms of absenteeism or even absent-mindedness. So there will definitely be a loss of productivity because somehow the way they process their thoughts will have been impaired by the use of drugs in one way or the other, which will in turn affect the entire productivity of the organization. How about how they relate even with other, with co-workers, let me put it that way, because there is a certain level, at which when people get addicted to all these things, it begins to show some symptoms, and one of them is withdrawal. Some of them will not want to be with other people, and there is no way you can be productive at work by being in isolation. And then some of them also will exhibit attitudes such as irritability or even excessive irritability. They become easily irritable. So at the slightest provocation, then you have like a very huge reaction that goes beyond what even happened initially. So somehow then it endangers the life of, the peace of other people who are co-workers in that area, thereby also reducing the level of productivity in the workplace. How about the health cost? So, there are organizations whereby somehow they have like a like HMO for their people, that's for their staff, whereby they offer them a form of support in terms of their health. So anybody who is experiencing substance abuse and had come up with the symptoms and the effects, somehow such a person might be coming down of whatever effect that is having on him or her, incessantly, like going to the hospital, going, to see a therapist, or even breaking down somehow. And now, in one way or the other, will have also created an impact in the organization. So in general, substance abuse has a huge impact in terms of lost productivity, in terms of breakdown in communication in the workplace, in terms of even breakdown in the body of the abuser himself, whereby the abuser is not productive, to himself in one way or the other.
All right, Kunle, glad you have you join us once again. I would like you to talk about some of the defense mechanism or the support services that should be put in place in the workplace in order to be able to help victims or those who are trying to reintegrate into the office space or into the workplace.
Thank you. That's very, very, very important, because the workplace is changing and a lot needs to be done so that the workplace will measure up. A lot had happened, and we need people to be productive in the workplace, and we tend not to care for their own emotions, to care for their own other aspect of life, including their social life. So if there is anything that affects any of those states that I mentioned, your emotional state, your psychological state, or social state, somehow it will impair your mental health, and then subsequently will impair your productivity. And that's why the new work culture should put all this into consideration. Like it was said earlier on, why do people even engage or indulge in the use of substance? Some of them do that as a result of pressure or socioeconomic distress, inability to meet their deadline. So they want to just have that getaway feelings. They just want to have that highness, and it's a temporary way of deferring your problem in one way or the other. It doesn't really solve the problem. So it will amount to just papering over the cracks. And it is even called unhealthy coping mechanism, people who take drugs. So it's now high time for employers and decision makers in the organization, HR personnel, to find a way of creating educational programs that will assist the employees in all these areas. So it's not only about them churning out performance time and time again without them also in getting an intake that will feel their emotions, that will feel their psychology, and even their social life. So that is why it's important, whereby trainings about all these things should be instituted in the workplace the more. I know we have trainings about the specific role a particular employee is carrying out, but how about trainings that will give them emotional intelligence, that will build their resilience? That's the ability to cope in the face of adversity. So what that is saying is, even if you don't meet your target this month, do not break down. Do not indulge yourself in the use of drugs. Do not somehow engage in unhealthy coping strategy. So that means you have to build up that resilience in the midst of adversity. See how you can get yourself together, put yourself together in order to now forge ahead in subsequent months. And then what are all the strategies they can use in doing all these things? Practicing mindfulness, practicing conscious breathing, and some other mental health related practices that are good for every individual in order to become mentally stable and avoid unhealthy coping strategies such as substance abuse. All this must be put in place in the workplace. In fact, there are times we have recommended that in the workspace, there should be a particular room that could be called a distress zone, distress, whereby employees could go at a point in time, maybe during the break time, and go right there to distress themselves. It could be a soundproof room whereby there will be like a gadget where they could listen to music, or they could do like a breathing exercise, nothing that serious, but for them to get off their seat, move a little bit, do something that will help them, so that there will not be a build-up of stress that will implode over a period of time. So when these things are done regularly, in one way or the other, it will limit the rate at which we are having the surge of substance abuse, even in the workplace.
All right, since we're talking about the workforce, it is not just about those who may be susceptible to abuse of substances, those who care for them. What about them? We know that even in the health sector, some are doing so much, and so it's a lot of stress on them too. So how can the health workers themselves, the caregivers themselves, ensure that while they try to provide support for those who need them, they're taking care of their health and their mental health as well? What can help?
Thank you very much. Yeah, this is one of the issues that came up during the COVID-19 pandemic. That was a couple of years ago, whereby the frontliners also were breaking down because of all the pressure. And the time has come for all the frontliners or people who are working in the healthcare sector, NHS workers, and every health worker to also take it as a personal responsibility. That's the first thing. They have to have that personal responsibility, because there is no way you can give what you don't have. So if you are not fine, if you are not healthy, there's no way you can treat someone who is unhealthy. So your own health is first, is paramount, and you have to also take personal responsibility about it. So that means when you are breaking down, when you are also feeling the pressure. I mean, there was a news, some years ago, whereby a nurse in the UK took his life as a result of working for a long period of time.